Hi, I'm Tiffany, one of the treatment navigators. Today we'll review what a diagnostic evaluation looks like for fertility. Before we get into different types of diagnostic testing, I'll touch base on who might want to seek treatment or gain more information about their fertility status. Then I'll go over a couple fertility facts. When building this section, I found it to be kind of alarming, that is not the message I want to convey, so that'll be a very brief section, and then we'll get right into the different diagnostic tests. There's a wide demographic of the different types of people we see seeking fertility treatments. We see people wanting to build their families, so single parenting patients, LGBTQ+ couples, people who suffer from recurrent pregnancy loss, heterosexual couples, and people who have a personal or family history of an inherited genetic disease. On the flip side, we see people who aren't necessarily ready to build their family just yet, but they want that option in the future. So we see people who want to freeze their eggs or sperm. Infertility is the inability to achieve a pregnancy after 1 year of unprotected intercourse. As we move into our mid-30s, it has been recommended that couples over 35 seek more information and possible treatments after 6 months of trying on their own. Infertility can be attributed to a number of things. When we break it down, we see about 1/3 of infertility being related to the egg, 1/3 being related to the sperm, and the last third is a combination of the two or simply unexplained. Generally speaking, people who are assigned female at birth are born with their lifetime amount of eggs. This starts at 1 to 2 million, and then by the age of 18, it declines to 200,000. And then at age 35, there is a significant decline in quantity and quality of those eggs. So to find out more information about your fertility status, there are a couple of routine diagnostic tools that we use. One being a semen analysis or hormonal evaluation. This can be done by a blood draw, and then also a uterine and tubal evaluation. For people with sperm, we do a semen analysis. We want to see the overall volume of the sample. We want to ensure the sperm count, how the sperm moves. This is called motility. We want to ensure it can get to that egg to fertilize it. And then also morphology. So how does that sperm look? Does it have a head and tail? Does it have 2 heads? We just want to ensure that it is also properly formed for fertilization. Another part of the workup is a hormonal evaluation. As I said before, this can be done by a blood draw, and we'll evaluate a few of the main hormones that play a role into fertility. That is your follicle-stimulating hormone, your FSH level, an anti-Müllerian hormone, or called AMH. This helps tell us more about your ovarian reserve. Your thyroid-stimulating hormone, so that's a TSH. If your thyroid's not in function, that can definitely play a role into fertility. And then we also look at estradiol and luteinizing hormone. All right, so the sonohysterogram. This is going to tell us a lot of great information. So we'll check out the uterine cavity, we'll see if your fallopian tubes are open, and take a look at your ovaries as well. So on this picture that you see, this is the ultrasound probe called a transvaginal ultrasound probe. So it is inserted into the vagina. We also see a thin, flexible catheter here. This is used to put saline into your uterine cavity. So uterine cavity here. We want to put that saline in there so that it opens up that uterine cavity so we can see if there's any things that might be inhibiting implantation. So is there a benign polyp or fibroid? We'd also be able to see any structural issues as well. And then over here is your fallopian tube and your ovary. What is really nice to see with tubal patency is to make sure when you're ovulating that that egg can travel through the tube to meet the sperm and fertilize. Here's another view of a sonohysterogram. On this side here, this is prior to us administering the saline. So this is your uterus. And then you see this little line here. This is your endometrial lining. So we want to open up that part of your cavity to see if there's a benign polyp or fibroid, as I was talking about. And on this side is after the saline deployment. And as you can see, it looks nice and clear. Nothing in the uterine cavity. Another assessment that we do is for your ovarian reserve. So during that sonohysterogram, we'll also look at your resting egg count or antral follicle count. So on the right there is an ultrasound picture of an ovary, and then all those little black dots, they kind of look like chocolate chips on a chocolate chip cookie. That is your AFC. So we'll take that information from the ultrasound, and then we'll do a blood draw looking at the anti-Mullerian hormone and come up with your ovarian reserve number, and then your provider will discuss what that means and how it could impact your fertility and specific treatment options that would be best for you. After your diagnostic workup is complete, you'll meet with your medical provider to review those results and then plan out your next steps. Thanks for watching today. This is just the tip of the iceberg in your fertility journey, whether you're gathering information or wanting to pursue treatment. It was really great to take the time and just get an overview, and we're excited to meet with you guys. Thanks so much.